Hi, good morning, everybody. I hope you guys had a great weekend. But then again, I suppose every day is a bit like a weekend these days. Anyhow, the average couple that walks through that door has a problem trying to conceive. Are we surprised? Not really. After all, this is a fertility clinic. However, what does surprise us most of the time is that despite the fact that they've been to see this doctor, that doctor, every other doctor, in fact, they've also spoken to the greatest doctor of all, Dr. Google. What surprises is that when you ask them, so what is the cause for your infertility? There seems to be some confusion. So my job in the next 4 minutes is to try and explain to you in very simple terms what are the causes of infertility. Very simple. There is the rule of 4. Number 1, egg. Number 2, sperm. Number 3, tubes. And number 4, other causes. So number 1, egg causes. When we talk about egg causes, we are talking about ovulation. And as we have previously mentioned, if your cycles are regular, it probably means that you're ovulating. If your cycles are not regular, very, very likely that you are not ovulating. If you're not ovulating, the chances of getting pregnant are rather slim. Why be surprised? No egg? How are you going to get an embryo? Number 2 is sperm causes. Sperm causes means male fertility. As I've mentioned before, male causes of infertility are very, very common. Up to 50% of patients who come to a fertility clinic will have an issue with the semen test. Okay, whether it's a sole cause of infertility or whether it is a combined cause of infertility, that is a different question. But male factor is real. Number 3 is tubes. Tubes refer to the fallopian tubes. And as you know, we have 2 fallopian tubes, right and left. And what does the fallopian tube do? The fallopian tube is a conduit. It allows the egg to be picked up from the ovaries at the point of ovulation. The egg then travels through the tube. And then if there's sperm that's coming from the cervix, the sperm and the egg will meet inside of the tube where fertilization happens. And if an embryo is produced, that embryo will then slowly move into the cavity of the womb. So if one or both tubes are blocked, obviously getting pregnant will be difficult. And number 4 is other causes. Other causes are a bit more exciting. Usually talk about cysts, endometriosis, adenomyosis, fibroids, and so many other possible causes of infertility. So again, 4 big things: egg, sperm, tubes, or other causes. Now, before I go, remember the golden rules, the 4 big causes of infertility. Number 2, remember that 40% of couples that come through that door and do all the tests, you will not find anything. They are therefore labeled as having unexplained infertility. The word unexplained doesn't mean that there's no cause. What it really tells us is that we do not know what the cause is. Okay, so remember, 40% unexplained. Do not be surprised if you are told by your doctor that you have been labeled as unexplained infertility. Okay, so that is the second golden rule. And the third golden rule to remember is combined causes of infertility, i.e. male and female, is exceptionally common. We believe that 1/3 of patients that come to a fertility clinic will have a combined cause of infertility. So do not be surprised when you are told that both sides have issues, because remember, a small problem on this side and a small problem on that side together lead to a bigger problem. Okay, so the next time you go to a clinic, remember to take charge of your own care. Know what is the cause of your infertility. Only then can you be focused and move your agenda forward. Until the next time, take care.